Hey YouTube, it's Marida. Welcome to another edition of the Nurse Lounge. And today we're actually going to talk about why is nursing, in terms of being a nurse, the profession of being a nurse, nursing, so difficult. So we're going to talk about 5 reasons. Is it five? Yes, 5 reasons as to why being a nurse or nursing is so difficult. If you want to see what I'm talking about, please stay tuned. Welcome back. My name is Dr. Marida P. I'm a registered nurse. I've been a nurse for 17 years. OBGYN, Well Baby Nursery, is my specialty, and I am a nurse educator. I teach at HBCU, and I'm doctorally prepared. And so today we're going to dive right on into what are some of the reasons. I'm going to give you 5. It does not necessarily have to be in any order, and this is not all inclusive, meaning that there are more reasons than this as to why nursing is so difficult. And if you actually have some, comment those below. If you have some other reasons, comment those below. Why is nursing so difficult for you? I will link this to a video that I want to talk about as to why people leave bedside. Some of these kind of go hand in hand, but I definitely want you to see or know, why is nursing so difficult? Why is this one of the hardest professions for us to navigate as nurses? This does not matter if you're an LPN. This does not matter if you are RN, if you are advanced practice. It does not matter. Some of these, you will have experienced some of these things, if not all of them. So number one, I have my list right here. Number one is that nursing is a 24/7 on the clock job, meaning that if you're working in a hospital setting, or even an LTC setting for some of our LPNs, that job is 24/7. Now, if you work in a clinic, okay, you have some time off or whatever, or you don't have to worry about certain things like night shift and weekends and things like that, unless the clinic actually has a night clinic or a weekend clinic schedule, then that may be different. But they're typically closed on holidays. Hospitals and LTCs are never closed, never closed. So they operate 24/7, 365, taking care of patients. With that being said, it is a 365 operation, meaning that that hospital or clinic, or not clinic, hospital or LTC has to be staffed every single day, day and night. Sometimes you need more staff, more days than others, but nonetheless, you happen to need staff. That means you have to be available. If you are a nurse in those environments, you have to be available to work nights, weekends, and holidays. These are the times in which we typically like to spend time with our family, have normal sleep schedules, and just rest. But we cannot do that because you're expected to be there, whether you take your 3 shifts during the week and you have your own call shifts. No matter what, you are expected to work. And most places are working 12-hour shifts. So for me, when I was working 12-hour shifts, I was gone from my house for 15-hour days because my commute was an hour and a half commute each way. So when I worked my 12 hours or 12 and a half hours because of our lunch, and that's if I got off on time, mind you, I was gone for 15 hours a day. I would leave my house at 5 something in the morning, maybe 5:30 in the morning. And then I would get home about 8:45, close to 9 o'clock at night when I worked my 12-hour shifts. So I was gone all day. So needless to say, I was tired. Number 2, staffing shortages. Because we always are short staffed. I don't care what unit you are. If you're a nurse long enough, you have experienced short staffing. And that is just a hallmark of nursing, is short staffing. You will always experience at some point in time where you do not have the adequate amount of staffing to meet your needs. Now, when I say that, you may have staffing in terms of the numbers. You may need 3 nurses based on your ratio. So for instance, our ratios were 1-6 at the floor that I worked on. So that means 1 nurse had 6 patients. And with that being said, if we had 18 patients, we had 3 nurses. So by the sheer numbers, by ratios, we had enough staff. We was not short staff. But when it comes to the acuity of the patients, so if we had 18 patients and 10 of them were fresh C-sections, our acuity level is up. We need more staff because of the fact that our acuity level requires those patients have to have more interventions done, more assessments done, more vital signs done, and simply more medication as well. So with that being said, our acuity is high, but yet it doesn't reflect in our ratios. So we are still short staffed. And that is a problem because you need to be adequately staffed to take care of your patients. When you have short staffing issues, I can't talk today. You are forced to work short, obviously. You're forced to sometimes not get a break, sometimes not get a lunch, barely go use the bathroom. This increases your chances of medical errors, of intervention errors, of forgetting to do something, of doing too much of something. This also causes you to not be able to chart adequately, chart in real time as we should be. Causes us to stay late, causes us to make more mistakes overall, and it also impacts our at-home personal life when we have to work like that. So again, you may not think short staffing just has an issue with just nursing in general. It also has issues when it comes to you taking care of yourself and your self-care issues after the fact if you've gotten home. And let you work this way for a period of time. Maybe you've had a mass exodus of nurses for some reason, and you are at a period of time in your season, because some hospitals, some floors have a peak in certain patients at certain times of the year. So for instance, in the fall or in the winter time, you may see an increase of pneumonia, flu type patients. And for us, we see an increase in patients at certain times of the year regarding how many people have their babies. In the summertime, we may see a lot around October, November, December. We may see a lot influx. So when we have those influxes, but you don't have the staff to care for those patients, that creates a problem. So with that being said, that's something else to consider, and that takes a toll on it takes a toll on the patient. I'm not patient. It does take a toll on the patient. It does take a toll on the patient. It decreases patient outcomes. So it doesn't improve patient outcomes. It minimizes patient outcomes in terms of making sure that they are well taken care of. We don't get that. The third reason as to why nursing is difficult, again, not the only reasons, but number 3 on my list, is that we have workplace violence. Now, me personally, I have never, well, I take that back. Well, no, never mind. That goes to number 4. Number 3, workplace violence. So workplace violence is when typically it's a patient who is, I wouldn't say beating up on, but a patient who is being violent towards a nurse. And we have situations in which sometimes we can't do anything about those situations. And now they are now having legislation as which they're wanting to now be able to press charges against patients when they are acting violent towards nurses and nursing staff, healthcare providers and things and such. No one goes to the hospital to take care of a patient to be beat up. Now in psych, you may see patients like that, but they try to protect you, hopefully, with adequate staffing and also having in-services about how to protect yourself when patients become combative. That's something you may see in psych, but we don't see that in every component of nursing. You may see that even in the ER because they come in through the ER a lot of times to be cared for. You may see somebody withdrawing from a drug and you may see, or even on a drug, and you may see them become combative. We have security for that. But it does not help when your patient spits on you. That is considered to be violent. If they spit on you and they have hep C, that is not good. If they spit on you or they hit you or they take the needle and jab you with it, that is considered to be workplace violence. We need to do more about that. We are not coming to nursing to take care of patients to be mistreated or to be abused. That's what that is. So, and then of course, what happens when you get abused? You take that home with you in the sense that, you know what, you kind of internalize what's happening to you. Like, I don't know if this is what I really want to do. Again, that's reason number 3 as to why we are dealing with such difficulties in nursing. Number 4 on my list is bullying and harassment. That kind of ties into number 3 in terms of workforce violence. But bullying, harassment, that I have experienced. I have experienced being bullied by other nurses and even physicians. And it was not until the day that I said, you know what, like a bad relationship, I'm not going to cry anymore. I'm going to stand up for myself. I'm going to speak up when nurses and physicians talk crazy to me. I'm going to speak up even if I made a mistake. So even if I've made a mistake, there's nothing wrong with making mistakes and owning them. The problem is when we don't own them. So if I make a mistake, I own my mistake and I keep it moving. How can I grow from the situation? But I refuse to be bullied or harassed because of something like that. Bullying and harassment is like bullying and harassment will clear a nursing unit out. It will clear a nursing unit out. And this doesn't have to be from just your coworkers. Sometimes it's management who is bullying and harassing you. And I have experienced that as well. And I, of course, left that facility. It was even so bad with the harassment and bullying and how I was treated that I ended up filing I didn't file a lawsuit, but I filed a grievance at that hospital. And I ended up winning the grievance. And they ended up paying me so that I would basically let the situation die. And I did move on from that job. So bullying harassment is real. Nurses sometimes only survive 1 to 2 years of nursing because of this type of thing. And unfortunately, sometimes nurses are even taking their own lives as a result of the fact that they have been bullied or harassed to that point. This is never a good thing. This is another reason as to why nursing is so difficult. Number 5 I have on my list, why is nursing so difficult, is discrimination. And discrimination, as you all think, may be like, oh, it's always about race. Well, guess what? It is about race. But in this particular scenario, it's not just about race. Sometimes it's about gender and age. And you will find that race is the obvious one. I've been discriminated against because of race. But sometimes, believe it or not, take that aside, it's also age discrimination. You have women or men who, the older they get, they're not getting these jobs because they want that young blood coming out. They think that, youthfulness actually says something. And it doesn't. So be mindful of that. Also, when it comes to gender, if you notice, a lot of your CEOs, some of your higher up positions, your executive teams, even though they were in nursing specifically, they are men. So nursing is a female dominated profession. So since it's a female dominated profession, but yet men are in that top percentage of executive leadership positions, that is a problem. Why is it that we think that only men can lead and women cannot? That's discrimination, my friend. So be mindful that these things happen in a lot of different ways, discrimination and in age, in race, and in gender. So hopefully this has been insightful for you. Again, this is not all inclusive. You may have other reasons as to why you think that nursing is so difficult. Comment those below. Let's have a conversation about it. Follow me on IG, follow me on TikTok. And until the next time, you all take care. Bye-bye.